Get ready to listen, learn, and earn CE hours. This podcast features content from an accredited CE activity provided by Calibri Healthcare. Visit elitelearning.com/podcasts for accreditation and disclosure statements and instructions on how you may be able to earn CE credits.
This is Dr. Candace Pierce with Elite Learning by Calibri Healthcare, and you are listening to our Elite Learning podcast, where we share the most up-to-date education for healthcare professionals. For this podcast, we are going to go a little bit off of script. So for those of you who have been listening to our podcast, hopefully you remember our Invisible Agony series, or if you have not heard it yet, I really encourage you to go listen to the Invisible Agony series. In that series, my daughter and I, we really talk about her journey, our journey with CRPS, complex regional pain syndrome. So first, I want to say how much we've appreciated the uplifting comments, because yes, we actually do go through your comments on our podcasts and on our courses. And a comment that we often saw for the Invisible Agony podcast was requesting an update on her. So joining me today is Judah. And Judah, what news do you have to share?
I'm finally in remission.
Yes. So we are back to talk more about our journey through this chronic illness, but also we're going to get to focus on what it looks like going from chronic to remission. And to help facilitate this discussion, joining us is Christy Jacks, our marketing manager for nursing. Christy, thank you for taking on this role for Judah and I to be able to share our story, and hopefully it resonates with others.
Well, thank you so much, Candace, for the very welcoming welcome. And Judah, I am over the moon excited to talk to you. I think you are one amazing little girl, and I can't wait to find out about all of the things. So, girls, let's just dive on in if you're ready. Judah?
We're ready.
All right, girl. All right. Well, I'm going to start with Candace. Candace, tell me about the diagnosis your daughter received and your initial reaction to that diagnosis.
So the diagnosis she received, which we talk about in more depth in the Invisible Agony series, is CRPS, also known as complex regional pain syndrome. And this particular syndrome does not have a known cure. It does not have really a lot of treatment options as well, but it's also known as the suicide disease because the pain is so intense. It is rated, if you look at the pain scale, it is rated at the very top. The pain from CRPS is higher than amputation without anesthesia. It's higher than childbirth without anesthesia as well. So it's a really horrifying diagnosis to get. And over time, you can lose your functionality and go from, hers was in her low extremity, which is normally where you're going to see CRPS. It usually happens after some type of, it could be a simple injury as a sprain, a strain, a fracture, surgery. And it's where your neurological system resets itself to believe that you've had a traumatic injury to this extremity. It'll cut the blood flow off to that area, so it'll be cold and it'll change colors, and you'll see problems with hair growth in that area for lack of, the blood and oxygen that it needs. So it's a really horrifying diagnosis to get, and I already knew that this is where we were headed. So I think I had already started to resign myself to this is what was going to be. So getting the diagnosis wasn't as shocking to me because I think I had already started preparing myself.
Wow. How did you manage your emotions during all of that, Candace? I mean, as a mother, I don't
think my emotions really kicked in until we were in the midst of it, where I was really, because at first I was like trying to figure out what was wrong with her. We were going to all those doctor's appointments. And then finally we get that this is what it is. And so I already had a plan. And I was already able to work with those physicians to get this plan, started, to get treatment started, looking at options that were out there. And so my emotions really got the best of me when we started to not see her get better and we started to see her get worse. And I struggled, and I will cry through this podcast as I already feel it coming on, but I struggled with being a mom in healthcare who's been to school for so long, and I can't fix my own daughter. Like I can't fix it. And part of me feels like that's so selfish, for me to be like, I can't fix my daughter. All these diplomas and stuff are useless. I just need to throw them in the trash. But that's really where the most of my emotions sat, was I can't fix her. What do I do? How do I keep going with this? This can't be her life forever.
Goodness. How yeah, I don't even know, Candace. I'm amazed by you as well. I mean, to be honest. Judah, I think you're the strongest person I've ever met. Can I just say that to you? You are one strong cookie. Oh, I feel like I might cry this whole time just throwing that out there with you. Candace, tell me about some of the first steps you took to support your child through this diagnosis and treatment.
So at first, when we got the diagnosis, she likes to research stuff. She loves school. She loves, to do research. And so I immediately said, do not Google this. Do not look this up. I wasn't ready for her to see it by herself. I wanted to be there to walk her through it. Of course, she did. She Googled it at school. But
And can you remind me how old she was when this all started too?
So when we started this journey, she was 9. When
Right.
we got the actual diagnosis, she was 10. So CRPS is like, you have to make sure it's nothing else. It's a rule out diagnosis only. There's no specific test or exam that they do. They rule out everything else that it could possibly be. And when that's the only thing left on the paper, then they say, all right, this is your diagnosis. So we had some time between and hers started from a fracture. It was so minute that it didn't even show up until we did an MRI. So she's had 11 x-rays, correct me if I'm wrong, Judah, 11 x-rays, 2 MRIs, and a CT scan. And her fracture actually didn't show up until we had an MRI. She's had multiple ER visits because the pain is so intense. I'm like cutting off splints because she is screaming like she's dying in pain. But from let's see, it happened in the summer of when she turned 9, and she's a fall baby. So it happened, let's see, her birthday is in October. So January, after she had turned 10, is when we got the official diagnosis. But by that time, I'd already worked through, like, if this is it, this is what we need to do, this is what we need to ask for. And so I already had the plans laid out for the physician, and he immediately wrote the letter to get her into her first treatment program, and really helped us get through that.
Well, Judah, can you tell me how you felt when you first learned about your diagnosis?
Well, when I first got the CRPS diagnosis, my first thought and the way he managed to explain it to me was just that he didn't know what was wrong with me. And that's how it was something that was really scary, to have this idea that they don't know what's wrong with me. I'm one in like 1,000 of people who have ever had to experience something like this.
Wow.
And it happened to me, of all people.
What were some of the thoughts that ran through your mind, Judah, when this was going on, especially at the beginning?
At the beginning, it was more like trying to accept the fact that I had something like this, because I'd known that there was pain going on. I had felt it,
Right.
and I didn't understand. And just the idea of having a name to put to it, but also knowing that the doctors don't know what to do, it was scary.
Yeah, I'm sure. How about any specific moments or where you felt challenged or challenges that you faced? Do you remember something in specific?
I think some of the challenges that I faced was having to explain to people what was wrong with me, or explain to people why I might be over here crying or trying not to cry. And you get a whole bunch of mixed reactions from people. You get people who get all sympathetic, and you get people who try to ask questions to try to figure out exactly what it is. You have the people immediately looking for a solution, which I actually had one of my friends actually just try to, like, think, "Is there a way to fix this?" And then you have the
Aw.
people who don't have the positive reactions. And you have those who are telling you to pretend it isn't real. And so it's one of the issues of having the invisible disease, because you're not going to tell a person in a wheelchair, pretend you can walk. But if I
Right.
can't see anything's wrong with me, they're okay with telling me pretend it's not real.
Wow. How hard that must have been for you. I mean, you're going through everything and someone's trying to tell you to pretend it isn't real. I mean, goodness gracious, girl. Again, you are one strong cookie. I'm proud of you.
And I will say, like, when we started this journey, nobody sat us down and walked us through what this was. No physician knew what to do. Everything that we found and that we did is because we researched it and found it
Yep.
ourselves. We didn't walk out with a treatment plan. We walked out with a diagnosis and no idea what to do next. So, we were really feeling our way through unknown territory.
Well, Candace, that leads me to the next question then. I mean, what do you think of this diagnosis and of the treatment and everything that you guys went through? What was the most challenging aspects of your supporting Judah throughout this treatment?
So I really, last night, as I was, thinking about things for this podcast, I came across something that I had written. And so I really want to share this that I had written about her, because this was written after one of her worst nights. And it says, Judah, she's a fighter, refusing to let CRPS define her life or hinder her dreams. We've witnessed her strength as she works through the pain, often concealing it with a brave smile. But those who truly know her can discern the subtle signs that the pain is always present. And last night was particularly tough. After a long day, Judah went upstairs to take a bath, but little did we know she was struggling more than usual. While Blake and I tucked her younger sisters into bed, we decided to check in on her. There she was, sitting against her bed, curled up in a ball with her head in her lap, quietly crying. Our hearts broke for her, and we immediately rushed to her side, holding her close as she poured out her pain. She confided that the things she used to enjoy, like reading, no longer provided solace or distraction from the relentless agony. What upset her even more was her inability to get up on her own. She didn't want to bother us and instead tried to cope by herself, bracing against her bed. It was a poignant moment as Blake and I, for the first time in years, had to assist our oldest daughter in preparing for a bath. We helped her in and out, dressed her, and carefully tucked her into bed. As we lay beside her, Judah shared her struggles with faith and questioned why she couldn't feel God's presence in her darkest moments. Blake tenderly prayed over her, and together we cried with our beloved daughter. It's not easy to reassure a 12-year-old that everything will be all right when she knows that tomorrow, like the days before, will bring more stabbing, crushing, and burning pain. We remind her that she's not alone in her fight, even though she may endure the pain and solitude. She's not alone in the battle against CRPS. We plead with her to eat, as the pain often stills her appetite, and we encourage her to take off her shoes, because hers was in her leg, to maintain some level of functionality. We remind her to keep going because life doesn't stop for pain. This morning, she's still in bed, and it's the first time in 2 years with CRPS that she hasn't gotten up. But we won't lose hope. Judah's determination has carried her this far, and we believe it will continue to fuel her fight against the pain. And we'll be right by her side, offering love, support, and unwavering faith that she will conquer this battle. And so I think that just really shows those challenging aspects of trying to support her, because she is alone, or she was alone in the pain. With the pain, we couldn't take that away.
Hey, Judah, what's your reaction to what your mom just read?
I that moment in time is one of the few really, really clear memories of the years during the CRPS itself, because a lot of the CRPS is now fuzzy, or it's almost as if I'm viewing a lot of what happened in third person. But that moment when I completely broke down has been one of the ones that has stayed clear, and it was one of the scariest moments of CRPS. I had been trying to get ready for bed. I needed to shower, I needed to change, I needed to do all that, and I stood at the edge of my bed and I dropped. And I hit the floor and I couldn't move. I couldn't bring myself to get up. I was physically exhausted, I was emotionally exhausted, and it scared me. And the hardest part of that was the fact I didn't want to bother my parents. It's one of the biggest challenges with a disease like this is at this point, it just felt like I was being a burden. And it felt like I was just continuing to stress them out. And I would feel really, really bad, even though I couldn't control the fact that I was in this pain. And so I didn't call them. I didn't want to call them. I just wanted it to go away. And so that was got to be one of the hardest nights and one of the hardest challenges of dealing with this disease.
Again, Judah, you're amazing. I just want to give you a big hug. Candace, how do you balance providing care for your child through things like this and then managing other responsibilities?
This is a really tough 2 years and 10 months is how long we battled this before she went into remission. But during that time, actually, Blake deployed, my husband deployed. And so I had gone back and gotten her into physical therapy because she was starting to lose more function. And so it was trying to get her to physical therapy twice a week, trying to get everybody to school, trying to get, everybody to their activities, trying to provide comfort and love to, the other girls too, because every one of them feels loved differently. So I don't really know how I balanced all of that, to be honest. It was hard, but you're in a place where you don't have an option. You just have to do it.
Yep.
And so you do it. So that one's really hard for me to answer. I think most moms can attest that you really don't know how you do it in the moments. You do it because you don't have a choice.
Right. How about you, Judah? What are some of the hardest physical challenges you faced during treatment?
A lot of the physical challenges itself were in reminding myself that I had to go through the treatment to get better. And it was also the fact that I had been through treatment before and it didn't work. And so it's dealing with trying to keep going while at the same time feeling like you've already been disappointed and wondering if it's even worth it to continue going if it's not doing anything. If it's not improving me, why should I keep doing it? And so there was a lot of struggle within the fact of just having to go to physical therapy. I didn't want to go. I didn't want to go to treatment. I didn't want to get up in the morning and do it. At this point, it was just this fact it's not helping and nothing's getting better and it might never get better. And so that's one of the hardest parts about the treatment isn't even the treatment itself, but the fact that I have to choose to be in there and choose to do it.
Yeah, there's a lot of mental strain that you're dealing with for this illness too, not just emotional. I mean, how did you get through that, Judah? Like, I mean, day to day, like push yourself. I mean, you're a little girl, like that's tough.
Yeah, I didn't have the healthiest
Judah,
coping strategies.
Judah, wait, I want to first interrupt you for a second because I want to clear up before you go into that. Is the first treatment program that we went into, their goal was to teach her to accept the pain and live with it. Because if you look at CRPS, if you research it, they say there's no treatment, there's no cure. And so they're trying to say it's all in your head. And then they would tell us as parents that we weren't to acknowledge her pain.
Oh my gosh.
Yes. And so that's not a way to deal with this. So given that kind of backstory, Judah, I'll let you go ahead and finish what you were saying.
That changes things.
It does.
Yes.
Yeah, no, my coping strategies through this were not healthy. The biggest one, and really the only one I used, was completely avoiding the pain itself or avoiding the reality. And so I'd spent a lot of my time reading books, using music, because music was a way to like leave where I was at the moment. I would in normal just physical therapy treatment, a lot of my big distraction was I'd be reading while doing the exercises, which that's a skill in itself. The fact I was able to do that. And I'd sass them. I'd talk back to them in a way that I wasn't being rude, but just like playing around. And it was just the way to keep the distraction off the pain because I didn't want to deal with it. I didn't want to live in the moment. And there was a big issue when we actually got to a treatment that worked, where I would hide away in my headphones for a majority of the day and just have the music on because it was easier to distract myself from the pain than to actually live with it and try to work through it, because
Sure.
that was the only way I knew how to deal with it. Because if I'd kept focusing on the pain, I wouldn't have been able to continue. So while not the healthiest way to cope during it, it was really the only way I knew how that managed to somewhat work, because none of the breathing exercises did anything. Um, and just, I couldn't find anything else that helped.
I think you did the best you could, Judah, and it sounds pretty healthy to me. I can't imagine an adult going through what you went through and coping with it any better. So I think you did everything you possibly could. Now I want to hear about your remission. I can't wait to talk about this. So Candace, what was your reaction when you found out Judah was in remission?
So we're still new in remission at the time that we're recording this. So it's still fresh, and you're excited and you're happy and ecstatic and you're all those words. But at the same time, in the beginning, you're like, is it real? Is it going to stay? Is it going to stick? And so it's an emotional roller coaster. I mean, this whole journey has been an emotional roller coaster. We have been fighting this for, when she went into remission, 2 years and 10 months. From the time that she was an older 9-year-old, and she's about to be 14, we have been battling this. And so, shock. My child is amazing, and she beat a illness with no known cure per the CDC. So, it has been a roller coaster. I think looking back over that, I think you realize that there's some PTSD and all the things for everybody that we've been going through, because that was our normal for so long. And so my reaction is like jumping up and down. Oh my gosh, she got her life back. This is amazing. But is also a roller coaster ride of emotions that come with it. It's so hard to explain.
I mean, and how, in that aspect too, with Judah, how did you support her through this transition? I mean, again, like you said, it's the roller coaster of emotion, and Judah's probably thinking the same thing. Like, is this real? I've been dealing with this for so long. Like, how, what do you do as a parent?
I don't think anything changes from supporting her while she was going through it to now supporting her through remission. We are having to work together to find new normals.
Mm-hmm.
What does life look like now, without pain, without CRPS a shadow over her life? And together we've had to figure out, what are these new normals? But we're also having to support her through things that came up from the illness, where she locked herself away from the world and from reality. And, we're having to pull her out of those things. So we're having to support her sometimes by pushing her out there, pushing her outside of her comfort zone, to be like, hey, you got your life back. Get out there and live it. You earned it back. So,
Judah, how did you feel when you were told you were in remission?
I think it was one of the best things that's ever happened to me in my life. But it was also really strange, because I'd gone from living for like almost 3 years in this pain to suddenly just not having anything there. And so it was also just this weird, strange sensation, because there wasn't anything there anymore. And it was having to get back into the idea of, I have a normal foot, I have a normal leg now, there's nothing wrong with it anymore, and it doesn't hurt. And so there was also a lot of having to figure out what is like normal pain now, because when you're feeling the all-encompassing pain, you really don't feel your normal pain. And then suddenly you're back in it, and out of nowhere you're feeling like, oh, it hurts to sit crisscross applesauce for long periods of time. Now, I didn't know that. Yeah, so it's having to get used to this like new reality, but it's amazing because you've been fighting such heavy pain for so long, and it's gone now. And it's like the feeling of feeling free at that point.
Absolutely.
And I think Blake and I, every time she makes a noise, we're like, what? What is it? Everything okay? What's wrong? What's going on? And she's like, it's normal pain. And we're like, okay.
Yay.
Are you sure?
Well, Judah, when you found out too, was there something that you were like, I can't wait to do this, or I can't wait? Like, was there something that you were super stoked to do?
Sprinting. That was the one thing I had wanted to do with like CRPS, because I could not like run like or even push myself too fast or it would collapse. Fast I could get was like a jog, and even then it would end up with like all encompassing pain. So the fact that I could go a full sprint again, it was amazing. It was one of the best feelings I ever did.
Do you think now you're going to do a little track and field? You're going to be a runner now?
I don't know. It's kind of gotten to the point where like now that I can run, I just haven't since I've like really gotten back. But it's
Sure.
something I've sort of looked into. Because I used to be really, really fast. And I do want to build up back there to be fast again. But I also have to like start putting the work in and start training to actually
Sure.
be able to do that.
Very
I will
mature of you,
say,
Judah.
this little girl who is in this terrible pain that most of us cannot even imagine, she maintained straight A's all through her middle school years because she had this all through middle school at one of the top schools in the state of Florida, one of the hardest schools. And before we went to this clinic that we went to, and we spent 4 months and 2 weeks at this clinic for her to go through this treatment every day before she went into remission. She knew that she was going to have to push. So she started getting up early in the mornings and she was running through the pain because she's like, I have to be stronger in order for this to work, in order to go to this clinic and to hopefully be in remission. And so there were moments like what I read, but and that's why it was so abnormal with what I wrote, where she's, 2 years into this battle and she's not getting out of bed. She has fought. She has fought the entire 2 years and 10 months to try to have a normal life, to live a normal life. And the people that were coming into the clinic when we went to where she was thankfully was able to go into remission, people were coming in with CRPS that were in wheelchairs, that were in on crutches, on knee scooters. These people that were coming in. And so I would tell her through this whole journey, like, you've already done that hard work. You learned how to walk again. You learned how to be barefoot again. You learned and maintained it, and you worked hard to maintain it. And, we went to the clinic, not in a wheelchair and not on crutches like most of the people and most of the kids that showed up with what she had, because she'd already put in that work. So
What an
she's
inspiration
amazing.
she was to those kids, I'm sure.
Yeah.
Judah, what do you think? And Candace, you as well. What advice would you give to nurses who are supporting young patients and their family going through this?
I think I said this last time too, but it's the biggest thing is just to believe them and to help your kid feel like that, or just help the patient if you're a nurse to know that they understand that you're going through pain. They might not know how it feels, but they're not going to ignore it and they're not going to tell you, oh, it's made up, because they understand you're not making this level of pain up. And it's just that idea of them accepting that you are in this pain and not trying to undermine you or try to tell you it's not real, or
Sure.
to act like something else is causing it or something that's completely different is there.
Acknowledging your pain.
Mm-hmm.
Mm-hmm.
Absolutely.
How about you, Candace?
Acknowledging the pain is huge. I would say when you have a patient who has a rare disorder like CRPS, some physicians can go some nurses can go their whole career and never see CRPS, don't even know what it is. Take the time to look into it. Take the time to research it. But I also want to piggyback on what Judah said about acknowledging our pain. And CRPS by itself is known as the suicide disease because the pain is so intense and there's no known cure per se. And, people don't want to live in this terrible pain, and they see that as the only way out of it. And so what I would say is maybe we should reevaluate how we treat these patients. because, we went to a clinic that is highly known, supposedly has a really high rate the very first time when we first got our diagnosis, but a high rate, they say, of helping CRPS to go away. But all they did was tell us to ignore the pain. And as parents, they told us to ignore the pain. And all Judah wanted was for us to just acknowledge that she's in pain, acknowledge that, this is happening and this is what's going on. And for her, that really helped her to know that she wasn't alone, rather than being made to feel like I'm making this up and nobody believes me. And I think that really helped her to be able to deal a lot better with the pain. So as a healthcare provider, I personally believe that we need to reevaluate how we treat these patients.
I mean, yes, Candace, and I'm sure that would drive you a little bit crazy being in that position and someone telling you like, there is no pain, ignore the pain. Like, again, as an adult, we wouldn't be able to deal with what Judah went through.
Yes.
Well, ladies.
And CRPS is in your head, so they are correct, but because it's nerve pain. It starts in our brains and it shoots it down. That's how it works. But to say that, it's just in your head, that doesn't help.
No, it really doesn't. Well, ladies, we are at the end of episode 1. I would invite everybody to join us for episode 2. And thank you for joining this one.
This podcast featured content from an accredited CE activity provided by Calibri Healthcare. Visit elitelearning.com/podcasts for accreditation and disclosure statements and instructions on how you may be able to earn CE credits. Take your learning to the next level by subscribing to more podcasts on compelling healthcare topics.